Leadership expert Dr. Mazwe Majola suggests that government is sending conflicting messages in its fight against the spread of COVID-19. He says, for instance, according to the Health Acting DG Anban Pillay, there is currently a backlog of 80,000 tests for COVID-19. But the Minister of Health, Dr. Zweli Mkhize, says there is only 30,000. CoGTA Minister Dr. Nkosazana Dlamini-Zuma says that people can visit their family members during level 3 lockdown. But the Minister of Police, Bheki, Cele, says that is not allowed. Well, to talk to us about this, the leadership skills in times of crisis, we're joined via Skype by leadership expert Dr. Mazwe Majola. Dr. Majola, always good to see you, and thank you so very much for agreeing to speak to us here on SABC News.
Thank you, Flo, and good afternoon. Thank you very much.
Now, you've made a very clear statement saying that you believe that government is at this time dropping the ball in managing the COVID-19 crisis. Talk to us, please, about your thoughts, and if you can expand on that for us, please.
They started very well. They started with excitement, with exuberance, with positivity and optimism. The president managed to win the hearts of the whole South Africans. He managed to persuade and consult very well with different stakeholders, including politicians, scientists, religious leaders, and all others. And everyone was very happy with our president and with our government. But you can see that now we are not talking about the same president, the same president that made that great statement in March, and I think it was 26, or rather, yeah, somewhere there in March, and the president that we see now. You can see that they are very overwhelmed, they are very deflated, they are sending mixed messages, conflicting and confusing messages, which is not very good for South Africa. Yes, this is a crisis. We are dealing with a black swan here. We are dealing with an unprecedented situation. However, it's now when the leaders must be strong and must be courageous and they must lead very well. They must not drop the ball now.
Now, you know, Dr. Majola, one of the things that we keep hearing from government officials, we heard it just now in the briefing now, the economic cluster briefing, that this is a consultative government and that, you know, the government weighs up on what scientists say, and they also weighed up with other factors, as the president has also said as well. Are they doing a good job in terms of weighing up all these factors, or can some voices actually be ignored because these are conflicting voices, and sometimes it seems as though they're trying to please everyone? Is that what you're getting out of all of this?
Consultation is very important and very noble during difficult times or during crisis times, because leadership it's about paradoxes. Leadership, it's about balancing the polarities. So you'll always have different stakeholders, different people putting pressures, putting their demands and their interest on you as a leader. But it's very important that, of course, you've got to be a listening leader. You've got to listen to these people because you must take them into your confidence, but you must be decisive, you must be grounded, and you must have emotional stable. You must be emotionally stable, and then you must have composure as you deal with all these demands and pressures. because of course, yes, you cannot please everyone. And you must take people into your confidence and make them understand why you have taken this decision, why you have allowed this one, not this one, why you have made concessions with this one, not that one, because not everyone will be happy. So, of course, yes, consultation is very important and communication is very important during crisis.
And just in closing, there have been some complaints about the president's parting shot this week, saying it is now in your hands. And I heard Minister Jackson Mthembu kind of trying to clarify a short while ago what the president said. Do you think that, that is a good leadership phrase to use, that it's now in your hands? I mean, there have been people saying that it seems as though, the president is giving up his role as a leader by saying, you know what, it's in your hands now.
That statement was very confusing, and that statement was very unfortunate from the president. That is why I'm saying it seems like he's now deflated, dispirited, demotivated, discouraged. It's like succumbing to pressures. It's like someone who's saying that, look, now I live into your hands. Because I've tried my utmost best, but you want all sorts of things. There is nothing I can do. I'm giving what you want. It's not good for a leader to say that. A leader must always be strong and resilient and courageous. Because crisis is the time that really great leaders emerge, and tough times separate weak leaders from strong leaders. So we know that this is a very overwhelming time. Of course, that the president may be very tired. Of course, that the president may be very overwhelmed. However, that is why he's a leader. That is why we have leaders and we have followers. And unfortunately, that during this time of COVID-19 in 2020, he is the leader of the country, and he must take charge, and he must not drop the ball, and he must not be discouraged and demotivated.
All right, Dr. Mazwe Majola, always great chatting to you. Thank you so very much for weighing in on leadership in times of a crisis. We do appreciate that. Thank you, sir.
Thank you.
Well, the Africa Centre for Disease Control and Prevention is warning African nations against using